can take a sunrise, sprinkle it with dew, cover it with chocolate and a miracle or two. The candy man, ooh, the candy man can.
My background's very non-traditional. So I started out in life as an artist. I was very much, my strengths were in the humanities and the arts, and I struggled very much with math and science. I was, in remediation math, and I was told I could never, take calculus and these types of things. And I kind of bought into that, and I believed that, and I didn't mind that because I wasn't a math person, I wasn't a science person. I enrolled in a post-bac pre-med program. I found myself taking a bunch of neuroscience classes just out of interest.
It's funny how the brain is so attractive to calling a lot of people into medicine. Best masterpiece ever to look at it.
I came to medical school a little bit from a different perspective, and I found myself drawing most of my notes out, especially during anatomy, which was our first course. And in anatomy, it's just such an inherently visual topic with so much rich information that for me to learn it at a quick pace and to really understand it, I found that I was drawing most of my notes out, which made sense for anatomy. But as I kind of went on to other courses like biochemistry and those types of things, the abstract concepts, the very tiny molecules and the way things were interacting, and the long names, also kind of lent itself to more puns and comics and cartoons to help me recall some of that information. But I quickly realized that that's the form that I was going to learn by, and I thought that was really what was going to help me retain all that information.
And the way I look at your art is that you use it when you reach a difficult passage.
It's really kind of turned into a bit of a catharsis for me. So, and then as I started rotating in my third year clerkships, I was really struggling with some of the more demanding components of it, some of the more emotional components of it. And, in Western culture, I feel like graphic novels and comics aren't really looked at. They're looked at more of a sophomore kind of childish media, but it's really a beautiful way to kind of cope with and express some of the more difficult, intangible things that we deal with in medicine.
I think my main thing is humor. And oil painting is a very bad medium to tell a joke in. So that's kind of why I moved to cartoons. And actually, you're going to NYU in a month, aren't you?
That's correct.
The journey really starts picking up in residency. And first year residency, PGY 1 is worse than MS 1.
I was really drawn to medicine at a young age because when I was 9, I was diagnosed with type 1 diabetes. And there was no medicine in my family, no doctors anywhere in my extended family. So the concept of medicine was always a very romantic, kind of artistic image that I thought of it. And having this personal connection was the driving force. So I came at it from a much more personal kind of, the connection that I form with the patient is like, I will always feel like I'm a patient. Med school strips you a little bit of your free time and your autonomy and your ability to kind of work out when you want and eat things when you want. I just like to think of it as everyone's got their stuff, and mine happens to be in the form of a broken pancreas. And what it does for me is it allowed me to find my destiny in medicine, and it allows me to connect with my patients. So as much as I can, I try and look at it in the positives. But the truth is there are definitely some points in the day that are very difficult. Having a low blood sugar is a fear.
You came back to exactly where you should be, combining your history, your medical history, and your art is going to make you a really powerful doctor.
This is my jam. I love these Pigma Micron pens.
Oh, I love those. They're
so beautiful, and what's great about them is they come in these different sizes. This is an 08, and what I found with ink that you can, the kind of depth that one can create with hatching in ink is having different line widths. I think people really appreciate creativity. But what I found is that those who can paint can draw, but those who can draw can't typically paint. And the reason is when I'm drawing, I'm finding contour, I'm finding kind of contrast, and I'm finding this relationship. A painter is like a genius, that you are able to create these blocks of color and set them juxtaposed to one another to create a face and to create an eye and to create, bends and curves. My medium of choice, though, is I really like large-scale charcoal drawings, kind of like the one behind me.
Well, that charcoal drawing in the background, boy, that's a really nice corpus callosum you have there.
Thank you.
I'm really a colorist. A color to me is like a musical note. In fact, if I play a G, I see a blue. The music is like color, and the color is like a note to me. You and I are both artists, physicians, and our medium is medicine. I think people should be hybrids.
I feel very passionate about clinical medicine, and that's something I definitely want to be part of my life. But I feel like it would be a loss to me if I spent 5 days a week just doing clinical medicine and didn't do something else in addition or, together with. And, I'm not sure what that looks like quite yet. And I said to myself, if I make it through this process, if I get into medical school and I become a doctor, I hope that I retain all of those feelings I had 4 years ago, and I can help and tell other people to retain who they are and try and make it through.
What'll help you retain your humanity is your art. And you'll never, there's something about being an artist that keeps you humble. I don't know why, because you strip your left hemisphere off when you go into art and when you go into your studio. But, you have a bigger message. You got to keep that in mind. I do too, which is why, we're doing all this stuff. All of us are trying to do something so that the world's better.
The candy man can, 'cause he mixes it with love and makes the world taste good.
Makes the world taste good.
Who can take a rainbow?
Who can take a rainbow?
Wrap it in a sigh.
And there was this very intimidating attendant who had this kind of monotone voice, and he was very difficult to understand. He had a little bit of an accent, and he was a very serious man. And he would pimp us, and I would be so scared that I wouldn't be able to answer. I was kind of frozen.
It's hard to describe to people what the OR is like. It is such an unusual place of interaction and of power. You know that. You know how the surgeon's in power and things move around there. And as a student, you have to laugh at the jokes.